Hello guys, welcome. So guys, today we are going to look into the procedure manual, a very important tool in the medical field. Be it in clinical medicine, be it in medicine, be it in nursing guys, you need to be aware of your procedure manual. You need to have a view of your procedure manual. And what's the best way to be aware of your procedure manual? Now this video is going to take you through the guideline on how to use your procedure manual to make an effective procedure. Now guys, a procedure manual is a very important tool, be it to a registered nurse, to a working nurse, to a staff nurse, or to a student nurse guys. Especially to student nurses, as guys you get to be assessed. Now, you go to your assessment, you are not even aware of your procedure manual. You don't know where to find a certain procedure in the procedure manual. Now that is very bad, especially for you as a student. You need to always be aware of your procedure manual. Keep your procedure manual close to you. Make it as your storybook, guys. Make a habit of reading your procedure manual, guys. To be aware, get the procedures on your fingertips. Get to know what the procedure entails, what is required, the instrument required in that procedure, the environment, how is to be set, the patient, how is the patient to be set in that environment for that particular procedure. Now, guys, here is our procedure manual, guys. So basically, this one is for the nursing students procedure manual. As you can see, it has the logo of the nursing council, the nursing council of that different country that you are in. For instance, this is Kenya, so it has the logo of the Nursing Council of Kenya. We have the Nursing Council of Kenya there written. We have the title, the Manual of Clinical Procedures. Now, as you can see, guys, it's a very big book. It contains all the procedures that you need in any section or any unit of the hospital which you have been placed or you are stationed, guys. So the best part about the procedure manual is that it comes in subunits or in various chapters. Now, subdividing the content into various chapters. Now, if you're in the labor ward, you get to find the contents of the procedures carried out in the labor ward. If you are in the newborn unit, you get to find out the procedures carried out in the newborn unit. If you are in the ward, you get now to find the various many procedures to be carried out in the ward. If you're in the psychiatric unit, you get to find out the procedures carried out in the psychiatric unit. If you are maybe in the MCH or family planning unit, then you get to find the procedures that are required in the carrying out of the procedure of the carrying out of the family planning methods. And guys, remember, it does not leave behind the community or community diagnosis, especially for the community health nurses, guys. Now you get to a part where you get to find how to carry out even an effective community dialogue, guys. So when you open your procedure manual from the first page, now you'll find maybe various things. Let me open my procedure manual. Though it's very old, maybe you get the editions, it's written there, which the year of the publishing of the procedure manual. Guys, you go ahead, maybe you find the something information, the registrar of the nursing board of your various country, information from there. Now you come to the table of contents. Now in the table of contents, basically, now as I told you earlier, the nursing manual is subdivided into various units. So in the first, for example, the first chapter, the first unit, you are going to look basically on the fundamentals of nursing. Going forward, and then you read to the appendix. No, just the appendix, it gives you the easier navigation of your procedure manual. Basically, the appendix, as I told you, gives you the easier maneuver or easier access of your procedure manual, guys. Now you get the preface, some little information on your procedure manual, which you can even there. The best part about this, even it has the nursing diagnosis. That come up with the nursing diagnosis, guys. I know, guys. In the next episode, we'll be looking on how to come up with an effective nursing diagnosis. And guys, you need to be stay tuned on that channel in order to get that information, guys. So you go ahead, it contains a lot of information which you need to read, and now you get the fundamentals of nursing. Now, basically, for example, The first procedure is the observation of the vital units. Now, the observation of the vital units, it gives you the definition, it gives you the indication. What are the indication of doing that vital examination? What is the purpose of doing the vital examination? Now you will assess your environment. Basically, for nurses, you need to assess the environment, not only for the nurses, in any cadre, be it even a clinician. You need to assess your environment of the patient first before you carry out your procedure. Now, there is you assess. After assessing your environment, you plan. Basically, for the nurses, now you get to plan. Now you have assessed, you have seen this in the environment. My patients look like this. Now you need to plan in order for that to come out to carry out an effective procedure on that patient. Now you get the requirements. Requirements, basically what you need on the top of the trolley, on the bottom of the trolley. Now you need to have all the equipment ready before you start any procedure. Now you'll implement your procedure, guys. Basically, now if you follow the procedure manual, guys, I assure you, you are going to carry out a superb procedure. You're going to carry out an outstanding procedure. You're going to give out an outstanding service to that patient. Let it be known, if you're a working nurse, working practitioner, most of us ignore the manual. Why? Because we think maybe we got the skills on our hands. We got the information or at our fingertips. But guys, in order to give that outstanding customer service, guys, you need to have your procedure manual always close to you. Be it in that unit you're working, maybe in the outpatient, maybe in the newborn units, you need to have a procedure manual close by for easy reference. In case you need to refer something for the procedure manual, it becomes so easier. For the students, make it your storybook. Why? Now, during your assessment, guys, it will be like an easy ride. It will be an easy ride for you if you get every information you need on your fingertips. Basically, all thanks to your procedure manual. Now, guys, in the next episode also, I'm going to dive very step on how to effectively read the procedure manual. I'm not saying that you start now reading everything from step 1 to all those procedures and to the last one, guys. I know basically for most of us, we do read the procedures. Maybe if you are students, maybe you read wherever you are placed. Maybe if you are in the labor ward, basically you're going to focus maybe on the procedures carried out in the labor ward. Now, I'm going to give a guide on how to effectively read your procedure manual to give out an outstanding procedure, an outstanding customer service to that patient of yours or that client of yours. Now, guys, in order to get the information, you need to stay glued on this channel. Subscribe on this channel in order wherever I'm posted a new content drops on the channel, you get to be aware of your channel. And guys, also ask any question in the comment section. If you feel you have a question, maybe you're using the procedure manual, maybe some of us now we got contraindications or some contradicting cases whereby maybe you are a student, you are in the ward or in the unit that you are stationed. Now your nurses tells you that this procedure should be done like this procedure should be done like this. Now your teacher comes during the assessment. Now, you left, maybe you didn't follow keenly on your procedure as outlisted in the procedure manual. Maybe you followed now what the staff guided you. Now, the teacher become very harsh. Your lecturer is so harsh, asking, is that what your procedure manual entails? Now, guys, it is very important to always know your procedure manual. Even if during your assessment now you're doing your procedure, make sure you follow your procedure manual. If you have an additional information, maybe from the staff, maybe an additional skill from the staff, but basically the most crucial and important thing is that you put first what is written or what is guided or what is entailed on that procedure, basically in the procedure manual. Now guys, let's meet during the next episode where we're going to dive deep into the procedure manual. We'll dive into the procedure manual for nurses, procedure manual for clinical officers, and procedure manual for the medical laboratory officers, guys. So till the next time, guys, subscribe, like the video, share.